This quick guide to coping with head and neck cancer will cover stigma, eating and swallowing problems, restoring speech, stoma care, head and neck swelling called lymphedema, problems opening your mouth fully or trismus, tips for living with head and neck cancer, coping for caregivers, and support.
Head and neck cancer can have a big impact on your life. It can affect your speech, swallowing, and breathing. It can also affect your self-image if you look different after treatment.
Smoking, using tobacco products, and drinking alcohol are all risk factors for head and neck cancer. If you engaged in these behaviors, you may feel judged or to blame. Treatment side effects can cause changes to your appearance and/or your ability to eat. This can leave you feeling self-conscious in social situations. There are strategies for coping with these feelings.
To combat blame, shame, and stigma, if you smoked, used tobacco products, or drank heavily, forgive yourself. You can't change the past. If you still use tobacco or drink heavily, talk to your healthcare team to get help stopping. If someone asks whether you smoked, ask them, "Why do you ask?" Often people are just trying to distance themselves from their own risks of cancer and may not realize how they sound. If you hear negative remarks, use the opportunity to educate the speaker. You could tell them head and neck cancer isn't always caused by smoking. If your cancer is related to HPV, you could explain that almost all sexually active people will have the HPV virus at some point in their lives. You could also let them know that an HPV vaccine is now available. It is recommended for teenagers to reduce their risk of getting head and neck cancer and other HPV-related cancers as adults. Talk to other people with head and neck cancer to find out how they cope. There will be more information later in this guide on how to find support. You will probably need to take a break from your regular hobbies and social activities during treatment and recovery. Look for new ways to be social with others. Being isolated may put you more at risk for things like depression or stress-related illness.
Since the head and neck area is so closely involved with eating and drinking, nutritional intake is often affected. Eating healthy before, during, and after treatment is important. It can help prevent weight loss, lack of appetite, and other side effects of treatment. It can also help you feel better and respond better to your treatments. Work with your speech pathologist, medical team, and nutritionist to help you adjust to changes in diet and regain your ability to swallow. To learn more, see our Eating Well with Head and Neck Cancer booklet at www.cancersupportcommunity.org/HNCeating.
If you experience speech and voice changes, it may take some time to learn new ways to communicate following treatment. You can work with a speech pathologist to improve your voice sounds and clarity of speech. After a laryngectomy, there are 3 ways to restore speech: tracheoesophageal puncture, or TEP, electrolarynx, and esophageal speech.
Tracheoesophageal puncture, or TEP, is the most common way that surgeons try to restore speech. This procedure creates a connection between the windpipe and esophagus through a small hole at the stoma site. A silicone device called a voice prosthesis is placed in a small hole created between the windpipe and esophagus. This will create your new voice. You will work with a speech-language pathologist to learn how to talk using this device.
The electrolarynx is a battery-operated device placed at the corner of your mouth or against the skin of your neck. When you press a button on the device, it makes a vibrating sound. By moving your mouth and tongue, you can form this sound into words. You'll need training with a speech therapist to learn to use it properly.
Esophageal speech is made by swallowing air into the esophagus, the tube that connects your mouth to your stomach, and forcing it out through your mouth. As the air passes through your throat, it will cause vibrations. With training, these vibrations can be turned into speech. Since TEP speech was developed, esophageal speech has been used less often.
Once you recover from your laryngectomy, you will learn to care for your stoma, the breathing hole in your neck. You will need to keep the stoma clean, or else it will get blocked. Your doctor and nurses will teach you how to keep it clean and remove mucus from it, as well as how to cover it when you are outdoors. They will also explain how to bathe, exercise, cough, and sneeze with your stoma.
Head and neck lymphedema is swelling caused by extra lymph fluid that builds up in tissues. It can occur from tissue damage after radiation therapy. Lymphedema can affect your speech and your ability to swallow. Head and neck lymphedema is treated with manual lymphatic drainage and, in selected cases, compressive bandaging. If you feel or notice any swelling, let your healthcare team know right away.
Trismus occurs when your mouth doesn't fully open. It can be caused by tissue damage from radiation. Trismus is treated with exercise therapy and with devices that help you to stretch and open your mouth.
In this section, we'll cover tips for living with head and neck cancer, including dental care, depression and anxiety, cost and expenses, physical activity, support groups, talking about your appearance, social gatherings, and travel.
After head and neck surgery, always tell any dentist you see about your treatment. Ask them if they have experience treating head and neck cancer patients. If they don't, ask for a referral to a dentist who does.
Many people with head and neck cancer feel overwhelmed. It is normal to feel alone, angry, anxious, or feel a sense of despair. Depression and anxiety can make it difficult for you to cope with symptoms and treatment, and can affect your well-being. Make sure to tell your doctor if you're feeling depressed or anxious. Your healthcare team can help you get treated for these conditions, which can make a huge difference in your daily life.
Exercise and physical activity is important to keep your body and mind healthy after head and neck cancer treatment. Ask your healthcare team what exercises, such as walking or chair yoga, you can safely do.
Prepare how you will answer when someone asks you about the changes to your appearance, your speech, or your eating habits. Practice giving these answers to family and close friends. If you cannot speak or are concerned about people understanding you, have your answers printed on a card you can hand to someone.
Prepare for social gatherings where there will be food. For instance, let your host know in advance it may be uncomfortable for you to sit at a table when everyone else is eating. You may want to arrive later, after everyone has eaten. If you don't want to eat in public, try to find other ways to be social with friends and family so you don't feel isolated.
You can continue to travel after you have a laryngectomy, but it takes planning. Bring along a folder with your medical information in case you need to receive medical care while you're away from home. Also, carry a kit with supplies to care for your stoma. If you're flying, keep this in your carry-on bag. Don't check it.
Treatment for head and neck cancer and follow-up appointments can be costly. Keeping up with these costs can be overwhelming. However, there are resources that can help. For tips on how to manage the cost of cancer treatment, visit www.cancersupportcommunity.org/cost. Also visit the Head and Neck Cancer Alliance at www.headandneck.org to see if any financial assistance specific to head and neck cancer is available.
Caregivers are often very focused on their loved one. They may neglect their own health and well-being. It is important for caregivers to take care of themselves. Many caregivers benefit from support groups. They can talk about emotional issues, share concerns, obtain help, and feel less alone. To learn more, visit www.cancersupportcommunity.org/caregivers.
Coping with head and neck cancer and the changes it brings can cause anxiety, sadness, depression, or frustration. Many forms of support are available. People find individual counseling and support groups help them manage these feelings. These can be online or in person. The Cancer Support Community's MyLifeline.org is a great way to connect with your loved ones to help you through treatment or other tough times. Activities such as meditation and yoga can help you exercise your mind and body. You may also want to talk one-on-one with an oncology social worker, therapist, or spiritual advisor. You can also call the Cancer Support Community's helpline at 888-793-9355 or the Head and Neck Cancer Alliance helpline at 866-916-5107.